Yo, we live, baby. We live, baby. My people, you are welcome. You are welcome. You are welcome to Andy Session Live with Vinci Hair Clinic. You are welcome. Today we are going to discuss about whole lot about hair treatment. It's about hair treatment. All that we're going to talk about is hair treatment. Vinci Hair Ghana. We are going to talk about hair treatments with Vinci Hair Ghana, Vinci Hair Nigeria, and then the importance and what we should know about hair loss. So you not spending much time. They will be joining us so
Hello there.
soon. Welcome, Mr. Esther. Welcome
Thank
very
you very
much.
much.
Welcome. So as I was
Thank
saying to
you.
our people, we are here to talk about, hair treatments. We're here to talk about hair treatments with Vinci Hair Ghana and Vinci Hair Nigeria. So everybody have to stay grooved. We are going to solve all your hair problems. Anyone who out there who have a hair problem, this is the time for you to get your hair problem
Hello.
solved. Yeah, hello. So how are you, my boss?
Very well. How are you doing?
We are doing well. Yourself?
I'm good. I'm good.
We thank God. So
Thanks for having me.
yeah, so today we having a live session with hair Vinci Hair Clinic Nigeria, Vinci Hair Clinic Ghana to talk about male pattern baldness. We are going to talk about a whole lot to how the causes, the symptoms, and the treatment of hair, hair treatments. So anybody who have a hair treatment, problems, here is the place to be. Don't stay grouped, don't go away. We have a lot coming your way. So don't spend your time much. I will introduce Dr. Bennett. Dr. Bennett, please can you say hi for us so that they can know
Hello.
you?
Hello.
Okay,
Yeah,
Dr.
thank you
Bennett,
for having me.
thank you very
Yes.
much, Dr. Bennett. And then Dr. Essel, please can you say hi for us? Dr. Essel,
Hi.
thank you very much for joining us this wonderful
Thank
afternoon.
you.
Thank you for your time. We are so grateful for having us. Um, I would like you to introduce yourself a little bit, Dr. Bennett, so that the people can know you very well. Yeah.
Okay. Yes. I'm Dr. Benedict, the professor of the IC, a hair transplant surgeon here at Vinci Hair Clinic. Uh, so not just hair transplants. I'm equally very passionate about aesthetic medicine and yes, just making people look better and increase their confidence. Thank you.
That's good. That's good. Thank you
All
very much,
right.
Dr. Bennett. So, Dr. Esther, can you please be an honor to introduce yourself a little bit for us so that they can know you very well?
All right. I'm Dr. Excel Uchiamadi. I'm a hair transplant surgeon here at Vinci Hair Clinic, Nigeria.
Okay.
Yes, I'm very passionate about beauty, about aesthetics generally.
Okay. That's very great. So, Dr. Esther is at Vinci Hair Clinic, Nigeria. So, if you are in Nigeria and you want any hair solution, you have to visit Vinci Hair Clinic, Nigeria. So when you follow Vinci here, you can know their locations and everything. So we're going straight to our topic for today for a discussion so that we can get straight to the point. We can't waste much of your time. So today we are talking about male pattern baldness and then the causes and the symptoms and then how you treat it. A lot of
Yeah.
questions are there that people don't know much about how their hair is receding, they're having a bald head and the rest. So, we go to the question with Dr. Bennett to, to tell us exactly what male pattern is, baldness pattern is.
Oh yes. Thank you very much. Yeah. Now, male pattern baldness. That's the common baldness. But this is all about information. Everyone getting to know what it's all about. It is the typical baldness that we see in the streets. Okay. Yeah. So this is an androgenic alopecia. Another name for it. So that's the medical condition. So Basically, it's genetic, more or less, it's hereditary. We'll say it's a hormonal issue, that affects men, because of excess testosterone now being converted to the DHT, which is dihydrotestosterone. Now, this is the main positive issue, male pattern baldness. And so the pattern is what we see typically, when you say someone is bald, So that's basically what it is. Yes.
Okay, that's beautiful. That's beautiful. That's beautiful. So right now we have known exactly what male pattern is and how we can understand how male pattern is. At times it's about, we inherit it from maybe our family, our father, or the rest. Most people don't know.
Yeah.
Most people don't know about that.
Yes,
So we'll
exactly.
go to the next question, and we'll ask Dr. Asare to do us the honor to tell us what's the causes of baldness in men. What's the causes of baldness in men? Having a bald hair, what does it cause?
Okay, before I answer that, let me state clearly that the causes of baldness in men are the same with the causes of baldness in women. Okay, so the same thing basically cause baldness in both sexes.
Okay.
Like we say in medicine, common things occur commonly. So let me start with the commonest cause of baldness in men, which is the male pattern baldness, like Dr. Benedict rightly said,
Okay.
which is familial. It's genetic. So if your mom or your dad has androgenic alopecia, you're likely to have androgenic alopecia. All right. The next cause is, or the next common cause is alopecia areata. It's an autoimmune condition where your body's immune system does not recognize your hair follicles as part of you. It sees it as foreign and then decides to attack it. Okay. So it could attack it in patches, or it could be generalized, it could be widespread. So you could be having patches on your head if you decide to attack in that fashion. So that's what alopecia areata is. We have causes that are due to stress. We call that telogen effluvium. For example, if you're exposed to let's say traumatic event, like you lost a dear friend, or you're involved in a road traffic accident, or you just had surgery. These traumatic experiences can cause baldness, and this kind of baldness typically presents after 3 to 6 months. You start experiencing that you're shedding, your hair is falling off.
Okay.
So that's what we call telogen effluvium. It's the kind of alopecia you have from stress. Okay. Yeah, we also have alopecia from aging. We call that alopecia of senescence. As you get older, your hair starts to thin. It appears very similarly to male pattern baldness, okay, but it's not the same. It's as a result of old age. We also have alopecia that is from bad hair practices. It's not only women who do braids and twistings. Men also braids, men do twistings and the likes. So if you're used to weaving your hair very regularly, some women weave their hair every 2 weeks, and while you're weaving your hair, there's a tendency that you could pull tightly from the ends. When you do that, the bulb in the hair follicle gets destroyed and the hair follicle becomes dead. So that way you start growing bald. We call that traction alopecia. That's the cause of baldness as well. We also have alopecia from certain chemicals like relaxers, dyes. If you're used to always applying relaxers or using dyes regularly, over time you can go bald. Yeah, so these are about the common causes of baldness. Yeah, we also have baldness from scalp diseases. For example, there's what we call lichen planopilaris. It causes scarring on the scalp, and that can cause what we call scarring alopecia. That's a topic for another time. So scarring alopecia is also a cause of alopecia that happen in men. Okay, happen in females too. So these are about some of the main causes And it will be important to state here that no barber is a cause of baldness. Okay, I have stories where people say, "I just met my barber, and after he lined my hair, hair stopped growing." Yes, and your hair cannot just stop growing because your barber lined your hair. It's not like he casts cement on the area. Exactly. So the fact that your hair was lined shouldn't stop it from growing.
Yeah.
So it's important for people to know that no barber is a cause of alopecia. Okay.
Baldness. Okay.
Yes.
So if I get you very right, it means it's barbers are not mostly the cause of people baldness.
Not at all. Not at all. Not at all.
Let's say it again. Let people understand it really well. Barbers are not the problem
Because
that causes people baldness.
exactly.
Maybe it could be their products they use on the hair, like the dye.
Yes, use of dyes, use of relaxers, use of certain kinds of cream, especially creams that contain a very bad chemical called paraben. Paraben, you find paraben in a lot of relaxers, in a lot of hair products.
Okay.
This is not it's not healthy to your hair follicles.
Okay. So mostly the barbers they have a dye, a dye that they use when finishing a haircut. They will use on the customer. More times that dye contains some chemicals that fight with the hair and then it gives them the baldness. So I think so the barbers need to know what chemicals they are using on
Exactly, and
on the hair.
yes, and another thing is the frequency with which these dyes are applied. If you dye your hair every time or too regularly, then you can have such problems. I don't think you can have such issues if you dye your hair once in a while. It's not bad to dye your hair once in a while. It becomes a common practice that you do all the time. You could go about over time.
Yes.
Okay.
Hence the need for, when you come to the barbers, right? Because you are almost now the first point of call, to people when they come in, and you can easily detect, whether they are going bald or not. And that could just be the early stages of male pattern baldness, as the topic is talking about. So when your hairline begins to recede, either when we call the temporal regions in the frontal part as well, it indicates the early stages of male pattern baldness, as opposed to the hair, line being the cause of the balding. Okay. So it's early stages. So this is the awareness. So when you see that, immediately you point out to them that this is early stage of male pattern baldness. You have to do, and if you do something about it at that time, there will be no need for the more drastic actions as we talk about, as we move on in terms of management of this.
True.
So saying it means the barbers have a job to do. That when they see their customers or their clients
Exactly.
receding hairline or having a receding, at the crown of their hair, they have to prompt the barber, the customer, so that they can introduce, a place like Vinci to them, so that they can go for a free consultation, right?
Yeah.
So it means the barbers really have a job to do on that, and then I think, for the individuals to, they have to also let their partners or people who are close to them to check their hair type as they are together to see if they are receding, so that they can also educate themselves very fast and then get, Vinci for consultation so that they won't lose their hair. All right.
Absolutely.
So we go to the next question, Dr. Bennett. We go to the next question. So what type of what are the different types of baldness where we have? What are the types?
All right. Thank you. Now, there are various types of the male pattern baldness based on, we call it is a spectrum, a Norwood scale. So based upon that spectrum, we are able to tell immediately as to which stage, particular stage you are, on that scale. And when that is early detected and identified, the various management according to the stages will then be, implemented. Hence the overemphasis on early detection. It's so important. So whatever stage you are, once it's identified, we're able to tell. So it's based off on the pattern. Now, because it's more or less, we call it spot diagnosis, right? Yeah, so when we see it, we can tell. So first of all, there is a receding, and you see the hairline begin to go in. Some others will begin and present with the temporal regions beginning to go in. And at this stage, it's a particular type, particular stage of the male pattern baldness. And then as you go on through the spectrum, you'll find out that the crown will begin to become affected as well, until the whole part forms that typical, pattern that people see outside and say, oh, this man is bald, Likewise, a woman as well, but it follows a different pattern, which would the women will also want to know about that as well. There's a particular pattern that their own will also follow when it begins from the crown area and begins to spread outwards. So that would help them, identifying that there is a female pattern baldness going on there. So based upon that, we can tell. So it's all about putting the information out there. Man, if you're experiencing, any changes in your hairline, it's amazing now that young people, that they say you agree with me, what we see in the clinic every day, that young people now present with male pattern baldness at a very early age, as early as 2021, 22. It's amazing. But this is happening. Hence, we know the causation. We say it is familiar. The hormones are being evolved, and things are changing. Hence, the age is no longer the age of 40, 50, 35. It's no longer that. People are getting much earlier. And that's so when it's identified, then the solution can, be brought to them, presented to them.
True. That means we don't have to waste time when we see a little bit of, we see a little bit of my own like that.
Yes.
We see it in headline like this.
Something can be done
on anything. We don't need to waste time on anything. We just need, what we need is to find someone or find Vinci clinic so that they can direct us, or we can find a consultation so that it can work for us. At least than to waste time that we cannot no longer have hair here, and then we still you. That will be a different story. I said that would
time is follicle. Yes. So we'll say time is follicle,
Time is follicle.
Yes, time is follicle.
You see my own
earlier the better.
That means I have to be
yours you have some mild recession of your temples.
Yes, at the temporal region. Yes.
So I need to be coming to Vinci hair clinic for consultation. Wherever you are and you find this a little bit of same lining on your head, you have to know that you need an expert. You need someone who can direct you very well so that you won't lose your hair all. So I will recommend Vinci for you. So let's go to the next question so that we can know, what are the treatments and options for men who suffer from baldness. What are the treatment options for men who suffer from baldness? Mr. Esau, if you can help us with that.
All right. So the treatment option prescribed or recommended is usually dependent on what the current state is, what the current state of the hair loss is. like Dr. Ben said, the male pattern baldness is graded in according to the Norwood scale. So whatever treatment option that is recommended has to be what should fit for that particular stage. Okay.
Yeah.
So the treatment options are divided into medical and surgical. By medical, I mean non-surgical treatments. So this includes medications. The two most important medications are finasteride and minoxidil. Finasteride is a 5-alpha reductase blocker. What that does is it blocks this enzyme, which I just called. This enzyme is responsible for the conversion of testosterone into dihydrotestosterone, DHT. DHT happens to be the main culprit for baldness. Okay. So finasteride goes and blocks that enzyme from enacting that effect. Thus, it reduces the amount of DHT you have in your system. Okay, that's what it does. And then the next important medication is minoxidil. Minoxidil basically works by dilating the blood vessels. When the blood vessels are dilated, there is increase in blood supply. So this helps to improve hair growth. We also have corticosteroids. Corticosteroid therapy is indicated for cases of scarring alopecia. If you remember, I mentioned we have alopecia caused by certain kinds of scalp diseases like lichen planopilaris, could be ringworms as well. When you have ringworm and it heals, it can form scar tissue. That's what for scarring alopecia. So for such cases, we recommend corticosteroid therapy. Okay. We also have other kinds of therapies like the platelet-rich plasma known as PRP. People call it liquid gold because when we draw blood and we spin it, we extract the plasma part, which is straw colored. It's golden in color. Okay, so that's the parts we inject into the scalp or into the area where there is thinning. And it's usually done over 3 months, at a minimum of 3 months, one session every month. Okay. So that helps to reduce the tendencies of hair breakages. It helps to increase the density of the hair follicle. Okay. We also have mesotherapy. So mesotherapy it's a combination of different medications, multivitamins, and minerals. Yeah. It helps to improve. It's made specifically to improve hair growth. Yeah. So we go over to the surgical options. The surgical options are two, FUT and FUP. Follicular unit extraction is FUE. Follicular unit transplantation, that's FUT. Basically, the hair transplant is indicated for cases of baldness where it has advanced to a certain level where the medications and PRP might not solely solve the problem. Basically involves taking out the donor follicles from the back of your scalp and transplanting them to the areas that are bald. And of course, the fact that you have surgery does not mean that you will not need any other thing at all. So following surgery, it's important you be on finasteride and minoxidil by way of augmenting the quality of the results you get, as well as PRP and mesotherapy. So these treatment options, or whatever treatment option anybody gets, is dependent on the current state of their hair loss, simply put.
Yeah.
Okay.
Yeah.
Exactly.
So yeah. So I heard about, as you are talking about hair transplant, right? So that's what
Transplant,
you
yeah.
did for Ronnie the footballer, right?
Yes, we did that.
Ronnie the footballer, Man United footballer, right? So Vinci Hair Clinic did his hair for him. Ronnie.
For Wayne Rooney.
Where Ronnie?
Yeah. No, Vinci didn't do the hair transplant. But he did a hair transplant. Yeah, he did a hair transplant in the UK.
Like as my man was saying.
Yeah.
Okay. So that means there's a treatment if you have baldness. People think that there's no treatment when you have baldness. People do think that there's no treatment, that your hair can grow as it used to be. People think that there's no treatment. So here is the case that we want to know what are the treatments that Vinci Hair Clinic have and can offer for men who have baldness from Vinci Hair
Okay.
Clinic, a special treatment that
Yes.
they can offer for them. Please,
Yes.
Dr. Bennett, if you can
Okay.
help us with that.
Yes. Yes. All right. Thank you. So there are various treatments that we have here at Vinci Hair Clinic. As Dr. Excel has earlier alluded to, the various causes of hair loss. So it's categorized based upon what's causing the particular hair loss. So male pattern baldness, I will begin with it. So what we do here at Vinci Hair Clinic is we will treat it in a multi-therapy. So in other words, a combo. So depending on the stage which you present the male pattern baldness, we have medications that we will give to you. So the finasteride that Dr. Excel has spoken about, that's stops that enzyme from causing that conversion. We do offer it. As well as not treated. So these two medications have been highly researched. It's not more or less like what we do is evidence-based. So it's been highly researched and it's been proven to work at a particular stage of the male pattern baldness. So moving on, it now depends on some people will just be experiencing some form of hair breakage. My hair is a bit thin, so when we examine, we're able to see that yes, there is thinning, early stages. There's where PRP now comes in. What's PRP? That's platelet-rich plasma, the liquid gold. So we then inject it to increase that density. In other words, we make it fuller. You say my hair is thin. What does that mean? It's early stages of hair loss. So we do offer that as well. Likewise, in mesotherapy, we do a cocktail of medication that is, specially prepared for your hair. Then there are other more serious conditions, such as the autoimmune, that's the alopecia areata, and when that occurs, we do offer medications for them as well to alter that, to try to solve that condition because it's your own uh, immune system trying to fight the follicles. Now, we do offer that. Now, going further, we move to the surgical, which is FEV, FUT. That's what we are known for at Vinci. We are a hair transplant clinic. So we do offer that option for all our clients. Now, a stage comes when the male pattern baldness, there's nothing we can do about it, unfortunately. It's something that we don't like to see, that we get to a stage where, we have to, we don't have, we have to say, I'm sorry, we cannot do a hair transplant for you. Then we now offer the MSP, which is the microscalp pigmentation. Or in other parts of the world, it's also known in America, it's known as the scalp micropigmentation, SMP. It's one and the same thing. So these are medical grade pigmentation. Amazingly, people that have gotten to that stage where their hair, they think that nothing can be done, they will just rock the bald head, which is
Okay. That's really great. That means, a lot of people think that, doing a hair transplant and all the medication that come with it is so costly. Some people think that they cannot afford it, to pay and the rest. So I want to ask that for men who can't afford or to have surgery, or what can they do to grow their hair? Dr. Esau, please.
Okay, for people who can't afford to have surgery, we could recommend other treatment options for them, such as the PRP and mesotherapy. Okay, these treatments.
The network. Oh shit.
if the person prefers to rock a low shaped cut. So if a person cannot afford hair transplants, we could recommend other therapies like the PRP, mesotherapy, as well as medications.
Okay.
But still, whatever is recommended has to match with the current state of the hair loss, like I said earlier.
Okay. Okay, that's great. That's really great. That's really great. So, Dr. Bennett is gone. Is offline. We have some viewers asking some questions. So, you know, when Dr. Bennett comes, we go on. So someone is saying, when is the hair? Or say he's asking, at what stage will the hair loss get to the transplant can't be done?
Okay. Usually.
Okay.
Yeah. Like you said earlier, we have the male pattern baldness is graded according to the Hamilton Norwood scale. So when the person has gotten to stage 6 or 7, that is extensive balding. At that point, we can't offer a hair transplant simply because the available donor follicles, because donor follicles are gotten from the back of the scalp, might not be sufficient to cover the extensive area. Okay. So that is the point where we say, okay, look, we have to do an MSP because we cannot guarantee that the number of follicles we can get from your head is going to suffice for the extensive area of balding. So that's why we offer the MSP. And for a person to agree to do MSP, they have to be comfortable rocking that low cut, that low shaped appearance.
Okay.
Like Dr. Ben said, it's like it's medical grade pigments, like making tattooing on your scalp. So it's done in such a way that it blends with it has to match with your face, it blends with the hairs at the back and on other sides.
Okay.
But it's going to be generally low. So it's aesthetically pleasing.
That's great. That's great. Dr. Esau. So as we don't have Dr. Benedict, you know, a lot of questions, you know, going out here with asking the barbers, a lot of people ask us questions. So someone is asking, what can be do to open follicles? Someone is asking.
What can be done to
open follicles? Hair follicles.
Okay, I'm guessing the person is asking what can be done to maybe rejuvenate a dormant follicle.
Hair follicles falling out.
Hair follicles, I'm trying to get your question. What I understand is you're asking what can be done to revive follicles, right?
Yeah, I think so.
Okay. The PRP basically does that. It reactivates dormant follicles. Dormant follicles are follicles that are just there and they are not growing. Okay, they are just arrested in a particular phase of the growth cycle. Okay, the hair follicle has different growth cycles. That's a topic for another time. So the PRP is it reactivates these dormant follicles. It also helps to stimulate growth of thinned out hairs, thereby making the hair appear thicker and giving that appearance of fullness and thickness. Okay. So that's what you do, PRP, and then to achieve better results, you might want to combine that with mesotherapy.
Okay. That's really great.
Yes, and let me add. Can you hear me? Let me add. While it's important to be on the PRP and mesotherapy,
okay,
it's also very important to be on, most especially, finasteride. Finasteride is, like we said, it helps to block THT. Now, why that is important is because if you're trying to treat hair loss, it's important to stop further progression of the hair loss. Okay. Otherwise, it's going to look like pouring water into a basket. It's going to be leaking out. You're treating hair loss without stopping its progression. So while you're treating, it's progressing if you're not on finasteride. Okay.
Oh, okay.
Yeah.
So for me as a barber, you know, there's a lot of questions that people ask us that how can we how can we stop hair loss? How can my hairline come? And a whole lot of questions that they do ask us. But as you are here as a professional, as a doctor, it would be a right way to ask you if you can give us a little bit of, how can we solve and stop hair loss, and so that we can, slow the process or something like that. If you can give us something about it.
So if a person has male pattern baldness, which would mean that it is genetic, it is hereditary, and you're beginning to experience thinning, like Dr. Ben said, the thinning starts from the temples and then affects the crown as well. If you're noticing that your hair is beginning to thin out, that is when you should start finasteride. Okay? You start finasteride at 1 milligram daily for at least 3 months. That will help to stop that thinning process. Okay? And then if your hair has already advanced, if it has receded extensively such that there are no follicles around the temples, then we could offer to do a hair transplant and bring your hairline forward.
Okay. So it means that you just can't go in for any medication elsewhere. You just can't go in to buy, products that we think is outside, that people are saying it can help you grow a hair, but you may end up losing your hair. So as we have Dr. Bennett online again, as I was saying, a lot of people are going in.
Yeah, sorry about that.
Welcome, Dr. Bennett. A lot of people are
going. Sorry about that.
A lot of people are going from products that it doesn't help them to achieve what they want with their hair growth. And the advice that I'm as a personal barber giving them is not to go in for any products that they think it can be helpful, because I know one of the products that I personally witnessed. You have weakened some of my customers' hair, and it's so bad that if you want your hair to grow back, or you want your hair to the receding hairline to come back, you just need to visit Vinci Hair Clinic. They are in Ghana, Nigeria, and the UK. And you can follow them on Instagram to ask questions. And I think you have a free consultation at Ghana at East Legon, right, Dr. Bennett?
So yes, we do.
I'll be coming to you on one question. I asked Dr. Asare already, but I want your opinion from that. Is there any way to stop hair loss or slow the process if one has hereditary hair loss, like he inherits it or something like that? How can they slow it down?
Yes, absolutely. Yes, you can. That's why early detection is so important. So once that is known, you found out that you were experiencing the male pattern baldness. Immediately, you start taking finasteride. Now, it's important to remember that younger people as well do get hair, and that is why it's important that you see a professional. You see someone who knows, a specialist who knows about this. And so you come in for a consultation, which is free, and then we're able to tell you. So the answer to that is it can be stopped. It can be slowed down. As a matter of fact, you can stop it immediately. So the two medications, which is finasteride, should be used. Likewise, minoxidil. And PRP that you speak about, all these modalities actually help to not only stop but improve the appearance of the hair when it is found in the early stage. But I must say that the specialist, the professional must be involved in this treatment option for that person.
Okay, that's good. That's really good. So a lot of people who don't know, you heard it from Dr. Bennett. It means you can slow down the process of losing your hair. All you need, I think, all you need to know about hair loss and everything, you just don't have to, waste time and then say that, oh, if I go to that place, Charlie, the price be costing and the rest. They have free consultation that they do for people, right? So you just have to walk into their location, so that you can have a free consultation and know what's the best for you and what not to do and what to do. You understand? So,
Exactly.
you know, we are so glad. So we'll be taking some questions from the viewers and see what questions they are saying and what they have in mind. So someone is saying, so what do so what I do to just fade the side all the time, please, any help? He said from the top of my hair, now constant. I mean, it doesn't increase again, but the side does. So what should I do to? Oh, so please, can you get the question right? He's saying,
No, I didn't
yes,
get the question.
the top of my hair is now constant. I mean, it doesn't increase again, but the size does. So what I do to just fade the side or the time? Please, can you give him any help?
Okay.
It means this part cannot grow
Yes, yes,
anymore,
yes. I
but
get
the
it.
side does
Yeah.
grow. So,
Yeah, so
Dr. Benedict.
this is early stage. Yeah, so I would go ahead and answer that. I
Okay.
think that's young Pharaoh. Yes, okay. So young Pharaoh, what you're experiencing is it's typical pattern for male pattern baldness. You can see that if I can get your question right, the crown of your head is actually you know, thinning out. You're not longer getting hair growth in that area. So what can be done immediately is, like you said, you have to stop that continuous, you know, excess
Yeah.
DHT, you know, the DHT that is occurring, the dihydrotestosterone, which is the causative agent. I always try to call it, he's the bad guy. This is the one that is causing this problem. And so,
Yeah.
we can give you a medication, but we never tell you to go ahead and take the medication because you must do it together with medical professionals. So I would say you should come into our clinics and let us have a free consultation with you. And of course, we can begin the treatment, but the medication for you, stop it. If you've been listening to us, we give finasteride. Likewise, other combinations. But we will need to have a look at it, let it examine it, let's have a physical consultation where we examine your head and your scalp to see what's actually going on right there.
Okay.
So I'm sure young Pharaoh, I was able to answer the question, right?
So another question. So how long does it take to see the full results of a transplant? How long does it take to see a full result of a
To see the
transplant?
full
Mr. Esham,
result of the
if you can
transplants.
answer that for
Yeah.
us.
Okay. The time it takes to see the full result is about a year. Okay. Some professionals even say up to 2 years. But the hair growth following the transplant starts from 3 months. From 3 months, that's when you start to see visible growth, and then it progresses up to a year. By 1 year, you should tell how successful the transplant is. Okay, so the answer to
Very
that
true.
is 1 year on an average.
Yeah, that question is very important, you know, because sometimes when we do hair transplant here, Dr. Excel, you know, when we do transplant here, and when we're done, 2 weeks, some people want the hair to grow out. Sorry,
So the
it
next
doesn't
year,
occur that
you're already
it
paying.
doesn't occur that fast. There is a cycle to it. There's a different stages at which our hair goes through, you know, and it typically will take that long. However, from 3 months, we should begin to see some certain form of progress, depending. So we usually see it in range. It's a range, so it's important that people know that.
Okay. So it means when you have a hair transplant, you just don't have to expect it in just a few weeks or 2 weeks or 1 week.
Yeah.
It can take
Yeah,
6 months because it goes through
exactly.
process before it grows back.
Yeah.
Yeah,
Yes.
that's a
Yeah.
serious question that he asks over there because we be getting numerous of questions about that. Now people think that when you do a hair transplant, you just have to within a few weeks it will grow up, and I think
Nah, it
you
doesn't
answered it
work
very
like that.
well. So there's no question that they're asking again, I would like you to add anything that will be useful to the people, our listeners who are watching us. Anything that will be useful for the hair transplant, or if you have a bald, you have and the way you can avoid the baldness. So someone asks again. Someone asks again.
Okay.
Can anyone have a hair transplant? Someone just asked a question.
Can anyone have a hair transplant? No, not everybody can do a hair transplant. Like we said, if you're at node 6 or 7, which is the extensive or the most severe form of male pattern baldness, you can't have a transplant because, like I said, we cannot guarantee sufficient number of follicles to cover the extensive area of balding. Okay, so the answer to that question is no. Not everybody can have a transplant. Okay, we have to be sure that you have enough donor follicles to cover the bald areas.
Okay.
True.
Okay. So it's not everybody that can have it, because some people are already bald and they are bald to the extent that they are bald. Nothing will come.
Yeah, yes.
That means they can't at all.
Yeah, so those are the people we recommend the MSP for. And but like I said, the person who is being MSP is being recommended for has to be comfortable having that low cut appearance. Okay, so if a person is not comfortable having that low cut appearance, then they are not a candidate for MSP.
Okay. Yeah. Okay. Someone is asking. So what about laser hair loss treatment?
Can you come again, please?
Someone is asking, what about laser hair loss treatment?
Okay, yes. So we have another modality for, that's a good question, thank you, for stimulating hair, So it's one of the kind of therapy we call the stimulating type of remedy for hair loss. We use it together alongside other treatment options that we have. I said earlier that what we do is combination therapy. That's what has been proven to be effective. So when you're experiencing hair loss, depending on the stage, so what it does is actually to help to stimulate the hair growth, not on its own, I must say, but in combination with other therapy. So it's with these two that we can then say, fine, results can be, expected. Yeah. So what it does is to stimulate the hair follicles from the scalp.
So it means Vinci can offer laser hair treatment or not Vinci?
It's a cap, actually. It's a cap. Now, there are various types of laser, exactly. There are various types of laser. It's not the laser that you'll see in the typical aesthetic way, where laser hair removal, for example, there is scar revision used for laser. There are various types of laser and what it actually does. So for hair, particularly, it's a cap.
Okay,
it's a cap.
Okay, this is a serious question. This is a serious question someone is asking. He said, can I have a transplant on a scalp, like a wooden place on my head? And can I have a transplant? So you can see some example, like someone has a scalp here and you want to have a transplant. Bro, thank you very much for that question. So
yeah, that's
you can answer for us.
You can do a transplant on a scar. However, it will be important to note that scar tissues don't have enough blood supply compared to normal skin. Okay, so it's more or less like a 50-50 thing because of the fact that scar tissues lack enough blood supply for the follicles to thrive. Okay, so it's not like the transplant cannot be done. It can be done. Actually, we've done on a scar tissue that actually did very well. It had very beautiful results.
Yeah.
So it's doable.
It's doable.
But it's not 100% guaranteed.
100% guaranteed.
Yes, because it's not 100% guaranteed because the scar tissue does not have reach enough blood supply. Yes.
Yeah.
Without blood supply, the hair follicles cannot thrive.
Okay. Okay. So as you said, it's not 200% guaranteed, but someone's scalp may be so big that it gets into the skin. So you can't see the thickness of the skin there. So I think that type of scalp you can't do the hair transplant there, right?
Yeah, it's doing a hair transplant on the kind of scar that you just described is less likely to give results.
Yes, very good.
Oh, okay. Okay. That's great. I think your questions have been answered, and I think we are very good here. In our place we call something like Sakola. So when you are bored, we get to laugh at you, calling you Sakola man, or you are Kwame Nkrumah and the rest, having a big forehead and your shape is here. I think everyone who is having a forehead a big like this, and your line is like that, your questions and your problems have been solved today. I know without we closing the live video, I know you'll be going to our Vinci Hair Clinic for them to answer all your questions. And you have to follow them on Instagram so that you can ask them questions so that they can answer you. And then the free consultation, wherever you find yourself in Nigeria or in Ghana. The Ghana is so simple. The location is just, East Legon. You see the cemetery. The cemetery, just East Legon Cemetery, just right opposite. It's so simple to find Vinci Ghana in Ghana here. And I don't know about Nigeria. If Mr. Issa, you can show us the direction to Nigeria.
In Nigeria, we are located at number 3B Adekunle Lawal Road, Ikoyi, Lagos.
Oh, okay.
We also have a clinic in Abuja as well.
Okay.
Yes.
Okay. Okay. In so doing, I don't know if you want to add anything. If you want to add something to it, then we can call it a close.
All right. My final message to my listeners will be:
Okay.
don't attribute your hair loss to any barber. Okay, your barber is not or is never the cause of your baldness. Okay, there are many causes of baldness, and your barber is not one of them.
Yes, sir. Your barber, you hear it first.
And
your barber is not the cause of your baldness. Your barber, I beg. You believe your word. You know believe. I beg. You hear it from Mr. Isel. And let's see, Mr. Bennett, if you want to add something.
Yes. I would say time is follicle. What do I mean by that? Early detection is the solution, So once you get to that hair loss and you think, something is wrong with my hair, that's the right time to actually do something about it because it is cheaper, I must say, and of course, the result is quicker, faster. So when it begins, please immediately give us a call, and you will get a free consultation, and we'll tell you what to do, so we can save that hair because that's my passion. I want to save it. Thank you.
Thank you very much. Thank you very much, Mr. Special, from all the way from Nigeria. Thank you. We are so
Thank you for having us.
for your location. Mr. Bennett, we are here in Ghana. You know everything. We will go past some place and chop some meat. So we go chop some jollof.
Thank you for having me.
Mr. Bennett, we will go chop some jollof.
Of course.
Thank you everyone for staying tuned.
Thank you so much.
We are grateful for your time, and we are so grateful for Vinci Hair Clinic. All your questions, all your problems have been solved today. Please do well. Do yourself very well, not to waste time. Time is chronicle. As Dr. Bennett said, don't waste time. Just go. The time you see that a problem is happening to your hair, you just have to go for your free consultation, and you will know the next move. You watching me, you listen to me, please make it a time and visit Vinci Hair Clinic. And then you can follow them on Instagram, Vinci Hair Clinic Ghana, Vinci Hair Clinic Nigeria, Vinci Hair Clinic. They have a whole thing to tell you. They have a lot of solutions to tell you. So thank you very much once again for joining our
Thank
live.
you.
We are so
Thank you.
grateful. I'm Andis
Thank you for
Baba.
having us.
You know, as you know already, Andis Baba, the #1 Baba in Ghana. When you are in Ghana, please do well to pass through Andis Baba shop. Bless up to everyone who logged in. And
All
thank
right.
you, my doctors.
Have a good day.
All right.
Thank you. God bless you all
Bye.
for
Yeah.
having us today. We are so grateful. All right. Thank you very much.
All right.
Thank
Bye.
you. Bless, bless,
Bye.
bless.
Bless.
So, dear one, we are ending the live for today. Bless you. We will come your way the next time to bring you big things, big solutions, and everything. Wave your official. You are late. Next time, come early. We close for today. Next time, we come your way. Big up.
All right. Bye.
Bye.
Bye.